Well, COVID-19 has really changed the medical industry from telemedicine to treatment even. I spoke to Bruce Alpert with our partners, Kaiser Health News, about how the pandemic has opened the door for researchers who are trying to address a problem that has existed in the medical community for decades. So, Bruce, why are doctors rethinking some of the treatments amid the pandemic?
Well, they learned a lot of lessons during COVID, which is a good thing. Probably one of the few good things that came out of the disaster that COVID represented across the world. One of the things they're finding is that there is a lot of data that will be available soon, if it's not already available, about unnecessary health care. And the reason is that for a lot of people, their medical procedures, tests, and exams were canceled during COVID, or they didn't want to go into a medical facility and risk getting COVID themselves. So procedures and tests were canceled. Immediately prior to COVID, of course, routine medical care continued. So you can compare the outcomes for the patients who before COVID had these procedures and compare them to the outcomes of those patients who had those procedures canceled or postponed after COVID. And they're hoping that they're going to find some procedures maybe we don't need to do as often or at all for that matter. And other procedures, we better keep doing them, and maybe we even have to do them a little more often.
So, Bruce, I'm sure that you've heard this before. I mean, I know I have. People say, doctors, they overprescribe, they overtreat, they, get these unnecessary treatments. But why do doctors do that in the first place?
Well, we have some answers from about 2,000 doctors who were surveyed by Harvard University researchers back in 2017, and they cited a bunch of reasons, among them fear of medical malpractice. They wanted to show they did everything possible, these doctors say. So they, ordered the tests, they did the procedures, and if and when they're sued, they can say, well, we did try, we did everything we could. Other factors, well, some of these expenses provide a lot of revenue, and some doctors have some very expensive equipment in their practices that they need to pay off. That was another explanation. And a third explanation, which puzzled me, but this is what they're saying, is a lack of medical records or access to medical records. So they're not always aware that certain procedures had already been done or tests had already been done, or certain procedures should be ruled out based on previous patient experiences. So those are the major factors, at least that doctors cited.
That's really interesting. So health providers, they really had to think outside of the box this year, like a lot of us had to. So what other changes can we expect doctors to adapt, and what can we expect to see moving forward?
Well, for sure, I think telemedicine is here to stay, and a lot of people like it. A lot of people don't like it. I assume we'll have more choice in the future. Some of us had to do tele-exams because those were the only kind available during COVID. Now we may have that choice. And for routine care, you live in a city, for instance, where it takes you a good hour and expensive parking to get to see your medical provider. Maybe that computer chat is something that you might prefer in the future. So that's certainly here to stay.